Hello and welcome to Health Focus, a production of the Ministry of Health and Wellness. I am Fenel Neptune. One of the areas which is very important when it comes to non-communicable diseases, NCDs, is oral health. And today we have with us dental surgeon Dr. Janin Dublin-McIntyre to speak with us on this topic. Welcome to the program.
Thank you.
Great. Before we get into discussion as to the link between oral health and NCDs, first we'd like you to tell us, what is oral health?
Okay. So oral health is basically the way we keep our mouth clean, having healthy gums and teeth. So that's a ballpark definition of what it is.
Okay. And what are the common oral diseases?
The common oral diseases can be gum disease and also periodontal disease. Besides that, is also dental caries.
Okay. So would cavities fall in that same group?
Dental caries, yes.
Okay.
That's another way.
And for people, they might say, okay, I'm not sure if I have good or poor oral health. What are the signs of poor oral health?
Okay, so in terms of gingivitis, the signs and symptoms could be like some persons may say they have, when they brush, they see their gums bleed. That is a sign of gingivitis or bleeding gums, where the gums are inflamed, so when they brush their teeth, they bleed as a response. So sometimes some persons also say they see spontaneous bleeding, or they may spit out blood sometimes. So these are signs of gingivitis or gum disease. So the gums are red sometimes, red puffy gums. Another one is the periodontal disease, where persons may see their teeth shaky, very, very mobile or slightly mobile. They may also see the gums receding from the teeth. They may also see a separation between the gum and the teeth. So these are signs of periodontal disease. Sometimes they may see the tooth, the position may change, so it might be slanting or it may no longer be straight as it's supposed to be. So all that is a sign that there's bone loss involved, which is a periodontal disease, so the tooth no longer has supports as it's supposed to be aligned in the mouth. So these are signs of periodontal disease. Caries, some persons may see a discoloration in the tooth, or they may also say they have a toothache or an irritation, or they may say they have sensitivity to hot or cold. So sometimes they feel it and then they ignore it. All these are signs that something is going on in your mouth, and we also advise them with the symptoms they should visit the dentist in order to have a proper diagnosis.
Okay, great. And given that oral health is so important, how can persons actually improve the oral health?
Okay, so we started with the basic. We advise persons to brush. So we recommend using a soft toothbrush, not hard or medium. The soft toothbrush, it does the job just as well. It's what is recommended because it also helps to massage the gum and clean the gum. It also prevents them from having receding gums if they are not brushing correctly. So we recommend a soft toothbrush, fluoride toothpaste. We also advise persons to brush at least twice a day or 3 times a day if possible after meals. So you brush after your breakfast, after lunch if possible, and after dinner, but most importantly at night time, because that's the longest time the mouth is at rest, and that's the time when it's easier to have that accumulation and further decay and other issues. We advise persons as well, besides brushing, we advise them to change their toothbrush every 3 months, because you may have a bacteria build up in your toothbrush. So we ask them to change their toothbrush every 3 months. And something that is overlooked is flossing. So brushing and flossing goes hand in hand, because the brushing cleans the teeth surface, but the flossing cleans in between the teeth to help improve the gum and to remove any food that is dislodged. So you have to brush and floss. That's what the flossing completes the job. Especially at night, if you're going to floss once a day, you floss at night and then you brush your teeth. So the brushing, flossing, the going to the dentist. We advise that persons go to the dentist at least twice a year for a cleaning and a checkup or examination, because what we have found is that persons may feel, okay, I'm brushing 3 times a day, or my mouth feels okay, so there's nothing going on. And in several cases we have seen persons come in not knowing that they have a cavity, and maybe for an examination or for an x-ray they have a very deep cavity, or sometimes they never had pain or a lot of pain. That was alarming, so they never did that. And then when we take an x-ray, the tooth is already far gone, where the decay is on the nerve and the tooth is beyond feeling. So the only way you can be certain that there's nothing going on or everything is okay is by doing your frequent visits to the dentist so the professionals can advise you as to what is going on in your mouth.
Okay. And we know for NCDs include cancer, diabetes, high blood pressure. But people might be wondering, what is the link between oral diseases and NCDs? Can you tell us?
Okay, so there are two different areas. It can be a direct risk factor where persons who already have for instance, the person has periodontal disease, it can affect the way the medication works. So the pressure might not be controlled, and in diabetics, if they have gum disease or inflammation, the sugar is not controlled. So in terms of a diabetic, if the sugar is not controlled because of gum inflammation, it makes it easier for the condition to worsen. And as we know with diabetics, we know what happens with uncontrolled sugar and what it can lead to. Yeah. Studies have also shown that persons with gum inflammation or if it's not, the sugar is not controlled.
I'd like you to hold on to that thought because we are due for a break.
Okay.
We'll be back in a moment.
A habit of daily caring for the teeth, tongue and gums not only improves your oral health, it also helps maintain a healthy body. Here's how. Be sure to wash your hands and your food before eating. Rinse your mouth thoroughly after every meal and after brushing your teeth. Floss at least once a day before you brush your teeth along the lines of your teeth. Brush at least twice a day, including before bedtime. Ensure you cover the entire tooth surface. Avoid sticky and sugary foods, including candy, as well as carbonated drinks, as they increase your chances of getting cavities. Consume lots of water, fruits and vegetables daily. Wait at least 15 minutes after having acidic food and drink, such as citrus fruits and soft drinks, before brushing your teeth. This prevents damage to your teeth's enamel. Visit your dentist twice yearly. For further information, call the Dental Services Unit of the Ministry of Health and Wellness at 468-5314.
Welcome back. We will continue our discussion with Dr. Dublin-McIntyre on oral health and NCDs. Before we took the break, you were speaking on the link between oral diseases and NCDs. Can you continue with this point?
Okay, so in terms of heart disease, what can happen is that when you have bad oral health, that means you have an overload of bacteria in the mouth. Now, this bacteria can get into the bloodstream. And what happens is that when it gets into the bloodstream, it can combine with the platelets. And these platelets can lodge to the arteries of the blood vessels of the heart and then cause heart disease or a blockage. So that is one way. Another way is that in terms of strokes, studies have shown that 40% of the bacteria from the mouth are found in the fatty deposits that cause strokes. So that's another point that we should highlight. As well, in terms of diabetes, with diabetics, when you have inflammation of the gum because of a lot of bacteria in the mouth, this inflammation in turn prevents the medication from working the way it should. And with that, you have, with an uncontrolled blood sugar, it worsens the condition. And I can go further to say also that studies have also shown that persons, about 63% of persons with periodontal disease have had incidents of pancreatic cancer. So that is another thing that it shows how far it can go with just having bad oral hygiene. Also, with both the hypertension and diabetes, with persons who have with that bacteria in the mouth, it prevents the medication from working properly. So of course the condition will worsen, as I said. Besides this, it can also cause other health issues like ulcers. It can cause respiratory disease. It can also cause osteoporosis. It can also cause low preterm birth in women who are pregnant as well. So there's a lot of links. So it just shows the connection of bad oral hygiene with overall health.
Okay, so it definitely shows how important good oral health is,
Yes.
especially for people and also people living with chronic conditions.
Yeah.
What are the risk factors for oral diseases?
Okay, so a diet rich in sugary foods it can increase the chances of persons having cavities, because they may brush and so on, but they may not brush as often. If they're snacking very often as well, it increases the chance of having a cavity. If they don't brush properly, then you have a buildup of plaque. If they don't brush as frequent as they should, but most importantly after meals, because some persons may wake up in the morning, brush their teeth and not brush after the meals, but brushing after meals is the most important time, and especially at nights. Also, their water intake. We advise persons to drink a lot of water, keep hydrated, and eat healthy. So eating a lot of healthy fruits and vegetables, these things will help to also over a good overall diet, and it can also improve the overall health as well.
Okay, so why is integrating oral health prevention and management so important?
It's important because the persons who are, for instance, diabetic or hypertensive or on medication, because of the bacteria going into the bloodstream, it prevents the medication from working properly. So that means their sugar will not be controlled, neither will the pressure. So that means their condition can worsen if it's not controlled. It's also important because directly the bacteria itself, as I mentioned before, can actually cause heart disease or stroke. So you want to ensure that you don't have that overload of bacteria in your mouth, that you have overall good hygiene to prevent these conditions from worsening or to prevent other health issues. As well, if you have good oral hygiene, if you have healthy gums, healthy teeth, we need our teeth as well. So it would mean that you would reduce the chances of losing your teeth through dental caries or periodontal disease. And the teeth themselves have the function where we need our teeth for digestion, we need our teeth for our smile, we need our teeth for beauty, we need our teeth for proper digestion of our food. So all these are reasons why we need to maintain good oral hygiene so we can have a good oral health as well, overall health as well.
Wonderful. And what final message would you like to leave with St. Lucians as it relates to oral health and also tying it in with NCDs?
Okay, we want to urge the public to ensure that they make it a priority. Like other things, make going to the dentist a priority, because instead of just waiting until maybe you have a toothache or you have an issue, go to the dentist, do your regular visit at least twice a year. So if there's anything going on, that it can be captured early, so whatever treatment can be done in time. Also, those who are diabetic or hypertensive or have other health issues, it's important to maintain a good oral hygiene too, so in order for the medication to work the way it's supposed to, because there's no sense of you're taking a medication and then you have other risk factors and the medication isn't working the way it's supposed to. So the message is your oral health is a gateway to your overall health.
Thank you very much. Well, I want to thank you so much for being part of Health Focus and providing us with this information. Thank you so much.
You're welcome.
Thank you. Well, that's how we come to the end of Health Focus. On behalf of the entire production team, I am Fennel Neptune. Thanks for watching. Until next time.